for joining us for another informative, educational, and entertaining edition of Music and Medicine with Dr. Charles Modlin, kidney transplant surgeon, board-certified urologist, public speaker, and well-known community national leader for the elimination of health disparities, dedicated to informing you, the listening audience, about important health topics and health information that you, your family, and your community need to know, while at the same time providing you with quality entertainment, because music and entertainment is medicine. Dr. Modlin's co-hosts are Jerome Brown and registered nurse Jonathan Branch, and the program often includes special content expert guests. So, without further ado, here is the host of the show, Dr. Charles Modlin.
Hey, everybody. Thanks for tuning in for another very informative and informational and educational and entertaining rendition of Music and Medicine. As always, we have a very important program. Tonight, we're going to talk about a very important disease that we think that you should know about, your community should know about, your family should be aware of. It's sickle cell disease. And this is a very important topic that we've been wanting to cover for quite some time. I have a lot of information on sickle cell, but we have a content expert, expert in the field of hematology and sickle cell disease. So we're going to hear directly from the expert, Dr. Tonjeh Bah. She's a hematologist at the Metro Health Medical Center here in Cleveland, Ohio. So with that, I'd like to actually welcome on my co-host, Mr. Jerome Brown. Jerome, are you there?
What's going on, doctor?
Hey. So this is a very special program in celebration of Christmas, and
yes,
and
it is.
So the audience understands, we're pre-taping this evening. This is an also celebration of the upcoming MLK Day and everything that represents. So I have my Christmas tree behind me. Christmas may be over by the time that this is on air, but we have to recognize the holiday season here.
Hey, Doc, we just want to know if you're going to do everybody that comes on tonight, are you going to do them like Oprah? You get a car, we got 7 of them, man. So you got 7 cars to get. I already got mine picked out. So, I'm waiting.
Little Matchbox cars. So yeah, but no, we have a very important musical guest also. Dr. William Henry Caldwell, and we're going to, introduce him in a second. But I wanted to say a few words about Tonjeh Bah, and we're going to go ahead and bring her on as I introduce her. And again, she's a hematologist oncologist from the Metro Health Medical Center, and I'm going to read. I went to the website, and so. Dr. Bah, she's a graduate from Ross University Medical School. She did her internship at Louisiana State Health Sciences Center in Shreveport, residency in Louisiana State University, fellowship. She's board certified in internal medicine, also American Board of Internal Medicine Hematology. But what I wanted to share with the listening audience, and if anybody wants to read this themselves, go, you can Google Dr. Tonjeh Bah's, and it's spelled B-A-H, her information on Google. But there are many important patient comments, laudatory comments about Dr. Bah. Best in Ohio, she's world-class, provides world-class quality care. She's nice, she'll go the extra mile for her patients. She's the best provider you can have, and just love everything about her. She cares about her patients. Dr. Bah, listen, she's very interested in your opinion. She educates you and then helps you make the best decision for yourself. She's culturally competent. She's a caring person who I would recommend to any of my family or friends. So, I mean, that says it all. When you can get comments from your patients like that says it all. So, are we able to bring Dr. Bah on now? Is she available? Hey, there you are. Those are some impressive comments from your patients. Outstanding work. Outstanding work. So, thanks for joining us. And you're here with me and Jerome Brown.
Dr. Bah, how you doing?
I am good, Jerome. Thanks for having me.
Good.
So we're here to talk about something that you're an expert on, one of the leading experts in the country, sickle cell disease. So we know that it affects predominantly African Americans, people of sub-Saharan descent, India, South America, that kind of thing. But again, you're the expert. People didn't tune in to hear me talk about it. We want to hear you talk about sickle cell. How much of a problem is it for the Black community, for example? Looks like Dr. Bah may be having some technical issues, Jerome. But are you there, Dr. Bah? So she'll log back in, but I do have a little information. So sickle cell disease affects millions of people throughout the world. It's particularly common amongst the ancestors who came from sub-Saharan Africa, Spanish-speaking regions in the Western Hemisphere, South America, Caribbean, Central America, Saudi Arabia, India, and Mediterranean countries such as Turkey, Greece, and Italy. And it affects about 100,000 Americans, occurs in about 1 out of 365 Black or African American births. In Hispanics, it's about 1 out of every 16,300 Hispanic births. So you can see that it's more prevalent in Black or African Americans. And also there's something called sickle cell trait. About 1 in 13 Black or African American babies is born with sickle cell trait. That's different than the sickle cell disease. So Dr. Bah, are you back with us? Yeah, it looks like she might be having some technical difficulties. And this is what can happen, in this age of digital technology. And
yeah, of course.
So we understand it. I've had that issue before.
And Dr. Bah, whenever your signal comes back in, just start speaking so we know that you're with us. Okay. And then we'll go to you.
But Dr. Bah sees patients at the Metro Health Medical Center. Her phone number where anybody can reach her is 216-778-7328. So again, this is
I have a question, Doc. I have a question.
Yes.
You're a natural person that is not a medical technician or in college. We want to know what exactly is sickle cell. What is that?
So it's a hereditary condition. It doesn't occur spontaneously. Again, Dr. Bah would know more about it, but it's a hereditary condition where you can actually, so when somebody is born, you inherit genes from both your mother and your father, and your mother and father can carry the sickle cell gene. If you get a gene from your mother and father, and if they are both the sickle cell gene, then that's called homozygous, and you will develop sickle cell disease. Sickle cell trait is if you just have, and if you have sickle cell disease, you will be symptomatic. Sickle cell trait is when you just have the gene and you're not necessarily symptomatic. You can actually, some people with sickle cell trait will have some minor symptoms. And so sickle cell disease causes malformation of your red blood cells. Your red blood cells are produced by your bone marrow. And because of the trait, they sickle. Normally they should be a concave, like a flying saucer almost. And your red blood cells, there's iron in your red blood cells that actually oxygen attaches onto, that carries oxygen through your bloodstream to your lungs. And when you breathe in, that it attaches to the red blood cells and circulates that oxygen to the rest of your body. And so patients with sickle cell disease, because they don't have the appropriate oxygen carrying capacity on their red blood cells, and because of that sickled shape, when those blood cells get down to the smaller capillaries, they can become lodged and obstruct the flow of blood, and that actually can create intense pain and discomfort. in your joints, in your abdomen. It can affect your kidneys, your spleen, your liver, your lungs, your heart, your brain. I've spent the majority of my career performing kidney transplant surgery, and then there are individuals who wind up developing what we call end-stage renal disease, kidney failure from sickle cell. And some of these individuals require kidney transplant. Is Dr. Bah back with us? I'm not sure if she's able to hear us or not, but
can you hear us, Dr. Bah?
And what happens is a lot of these individuals, they have repeated sickle cell crisis. And again, that's where their blood it's more viscous, it's thicker, and it becomes very sluggish.
Wow.
And that can lead to repeated episodes of severe pain and discomfort requiring repeated visits to the ER, emergency room, where individuals oftentimes need very powerful, potent narcotics to treat their pain. You know, one treatment is blood transfusions. And that's one reason why the American Red Cross oftentimes is looking for blood donors. Because these individuals need blood transfusions. Again, there's more advanced therapy that, you know, Dr. Bah would know more so than I, in terms of how, you know, this condition is treated. If we're not able to get her on, we will get her back on, so for the benefit of the viewers. But we thought this was a very important topic to cover. We actually do have some individuals from Sickle Cell Support Group from Kindred Spirits. We're going to bring them on in a second, but first I wanted to introduce our entertainer. And again, this is Music and Medicine. We know the viewers tune in for this very important medical information, but they also tune in not to be bored by me, but to be entertained by.
We don't like dry turkey on the holidays, man.
Right.
We gotta have some juice in the turkey, man. Come on, man.
So you're an entertainer, you know, Jerome. But actually, Dr. Bah, it looks like you're able to hear us.
You think I'm funny, huh? You think I'm funny?
You very much are. You know, it's there was a movie with Joe Pesci. I won't go into it. You think I'm funny? You think I'm funny? You know. But
Dr. Bah, you back with us?
Are you with us now? So yeah, it looks like she's still having some
I can hear you now. Sorry about that.
Oh no, we can hear you too. Good. So I just kind of gave a general overview of sickle cell, which is at the elementary level compared to your knowledge. And I was talking about how sometimes these individuals, or often, these individuals have to resort going to the ER over and over again. A lot of times, unfortunately, they're mislabeled as drug seeking, which they're not. They're in actual real pain. And I was talking about how a lot of times blood transfusion is the treatment. But again, I'm sure there's other more advanced treatment options now than there were when I was in medical school. So maybe you might tell the listening audience, maybe, how do you manage patients now with sickle cell disease?
So, Dr. Modlin, you are right. In the past, we have used blood transfusion to support our patients with medicines that are used to, to support sickle cell, like to support our patients. One of them, we have monoclonal antibodies that are used. We call it Adakview. We also have voxelotor. There are different medicines that are used now. And I think there is hope in the field. We have great, improvements in supporting these patients. And there is the chance that these patients can be cured from their sickle cell with gene therapy and stem cell transplant. That is the new, that's where we are going to right now. And, I see that sickle cell has a bright future. Not long now, our patients will be cured from sickle cell. And this is something that we never thought of in the past.
Wow.
That's remarkable, Jerome. And I
Super
do know
remarkable.
that, yeah, and I do know that Metro Health is developing a stem cell program. So that's going to be happening right at Metro Health.
That is correct. That is correct. So it will be right here at Metro. We have the doctors with that desire to help these patients. It's a special population, and like you rightfully said, many people do not understand this disease.
Yeah.
And they mislabel them, but I'm big hard to make change. Yeah.
Hey,
So,
Dr. Bah,
yeah.
What caused you to get into the field? What's your passion?
Yes, Jerome. So I was born in Cameroon. That's a country. It's in West Africa.
Okay.
Yeah, and my family, we never had sickle cell patients. My neighbors, it was a couple. They had this family, their children died before they are 3 years old, and they were labeled as the witchcraft family. So I grew up thinking sickle cell was like a curse, a witchcraft. And my family, because all of the children were healthy, we were labeled as the family that was blessed. And growing up and learning more about the disease, I found out, there is something that could be done, that I can do. And I felt the call to go in and learn about this disease, and not just help the people here, but go out and educate, patients. So once a year, I go out to Uganda, to a little tribe where they have a lot of sickle cell patients. The children die really early. I go there and I spend a month with them, educating them, teaching, providing some medical help to them.
Right. That's wonderful. Have you seen that family since you come back here? Have you seen the family that you grew up near?
No, I haven't seen them. We lost contact point as we were growing up, but they have all kids were born at the same time with the siblings and my siblings, and they would they die, and my family was doing well. I didn't think there was nothing we did to deserve all all of that, and I don't think they did anything to deserve all that suffering too. So when I had the opportunity to be a doctor, I felt I could bring that change, maybe not to this family, but there are other families that need that education, that help.
So if somebody has sickle cell trait, what do they need to know? So should every black person be screened?
I recommend you're screened. Right now, newborn in the States, it's part of the newborn screening. Whether you're white or black, it doesn't matter your background, everyone is screened. In the past, it wasn't the case. So what I strongly recommend, there's a family history of sickle, I recommend you take the test, because this will help you, first of all, to make life-changing decisions, the person you marry. Like two carriers, if they get married, there's a 50% chance of, there's a 50% chance of having a child who is a carrier, and a 25% chance of having a child with full-blown sickle cell. And I think if you know that you will bring a child into the world who will suffer from the time they are born, you will not want to do that. I mean, you will rethink your decision in marriage. So,
So we will be providing free sickle cell screenings at our upcoming Minority Men's Health Fair at Metro, Thursday, April the 27th. It's going to be 3 Metro Health locations, the main campus on West 25th Street, Cleveland Heights location in Ohio City. Again, that health fair, it's called the Minority Men's Health Fair. It's actually open to everyone, regardless of race, ethnicity, and women are welcome also. So that is one of the screenings that's going to be made available. Okay. So this is very important information that is being presented. I want to bring in somebody who's been waiting in the wings, and we've been waiting for him for quite some time to get
party time.
It's party time. Dr.
Party
William,
time.
Yeah, Dr. William Henry Caldwell. And he has a very impressive resume and CV. I'm not going to read everything, but he's a resident conductor for the MLK, Martin Luther King Celebration Chorus, for the Cleveland Orchestra, and the Classic Roots Community Chorus for the Cincinnati Symphony Orchestra. He maintains a very active schedule as a lyric baritone, and maybe he'll share that baritone voice with us very briefly. We'll see.
He's going to have a couple of dollars, man.
Yeah. He's had recent engagements with the Cleveland Orchestra, the Dayton Philharmonic. He's traveled the world. He's a retired full professor of music at Central State University in Wilberforce, Ohio. I mean, this guy has so many accomplishments. He holds degrees from Stillman College, magna cum laude from there, University of Texas, vocal performance. He studied in Italy, Switzerland, toured extensively throughout Europe, the United States, Asia, and the list goes on and on. I would actually recommend that you and the audience, Google Dr. Caldwell to even learn more about him. So with that, can we bring Dr. Caldwell to the stage? Oh, there he is. There he is.
Oh man,
the man.
The man with the $1 million hair.
Yeah.
The $1 million hair. I call this my pandemic hair. I did not get a haircut during the pandemic at all because I didn't go to the barbershop. So what you see is what you get. But thank you so much for reaching out, Dr. Bah. I wanted to ask you some questions, even though I'm going to talk about music. But my niece has sickle cell, and she's about almost 48 or 49, but she still has times when her body just kind of shut down. And I've heard about this all my life, so it was very good to hear you speak on it, and I feel better because I was under the impression that African Americans got sickle cell because where we came from, we needed the sickle cell to fight off malaria. Now, is that true? Was that true?
Give her some time here.
Okay.
Doc, did you hear of anything about that?
Yeah. So, I mean, again, from what I understand is, obviously malaria is endemic in Africa, and I don't know if is Dr. Bah, she able to respond, but what was noticed was these individuals who had this sickle cell trait and disease didn't acquire malaria. Again, that's my understanding.
Yeah.
So it was protective. It was a protective gene against acquiring malaria. But obviously, in most countries nowadays, that's not a major issue, especially in the United States. And it leads to much pain and suffering. And again, it's very disturbing that this affects our young children, adults and children alike. But it's something, again, that Dr. Bah, recommended that everybody get screened. Now it's a requirement for, regardless of your race or ethnicity, that, when you're born, you get screened. But for those of us who are older, many of us may not have been screened. So, and what actually was enlightening to me is that Dr. Bah said there's hope in the future, gene therapy, to where this is a disease that can actually be cured.
Yeah.
So Dr. Caldwell, I've seen you for years. I've admired you, especially at the Severance Hall Cleveland Orchestra MLK concert. Everybody, when you walk in, I'm just wondering, how does it feel when you walk into all that applause? I've actually imagined maybe walking into the operating room with people applauding me, but that's never happened. It's never going to happen.
Well, when I walk out and they're doing that, it relaxes me because it proves that I have something to offer and they want to hear it. And it's always been the case like that at Severance Hall. I don't think people are aware, but that venue at Severance Hall, and Severance Hall itself was designed exclusively for the Cleveland Orchestra. And the Cleveland Orchestra is one of the finest orchestras in the world, not the United States or Ohio, but the entire world. If you Google it, the top 10 orchestras in the world, Cleveland is going to be in the top 10, and it's going to be sometimes as number one, sometimes as number two, depending on the circumstances. But it has a tremendous history. So when you go in there knowing that you've worked hard, that if you're on that stage, you're prepared to be a part of a great legacy, a great history, because if you're good, that's where you go to perform. And I've been fortunate in that association reached out to me back in 2003 when I was much, much younger and I didn't have gray hair. And I was working with young people in higher education. But after I retired from higher education, teaching in higher education, I could not retire from the art because the art is a part of me. I'm going to take it to my grave. Yeah. And so they brought me back to work with the MLK chorus on a regular basis, exclusively with him. And it's just wonderful to see the people that are involved, because the ages in the MLK chorus range from like 30 to like 96 or 97 years old. And these are African Americans, and sometimes they're other people of color and other sections of the community participate. But to see the impact that this music has on their spirit, they look forward to it. Some come with walkers, some come with canes. Some of them read music, some of them don't read music, but they all have the most important thing, the desire. They really want to do it. And they do it, and they do their best. I don't critique them like I would critique I would critique a college choir, where I would rehearse with a college choir every day, for an hour or whatever, so it can be totally what I want it to be. I can mold it. These people I see 2 weekends, and then we're on the stage, which also lets you know that they really have to love what they love, because they're able to digest all of this music, and then like 2 weekends of rehearsals, then present it on the birthday of the Reverend Dr. Martin Luther King Jr.
I'll tell you, from an audience perspective, to us, it seems as if you've been rehearsing for 6 months. With it.
Oh no. So, no.
I don't know if you should have told everybody that one, Dr. Caldwell.
Yeah. But it shows how gifted and how dedicated and how talented they are. And I keep telling everyone, the Cleveland area, when it comes to the arts, periods, classical music, gospel, or what have you, you can find it in Cleveland. And even though I'm way down here in Dayton, Ohio, I find more excitement sometimes up north where you guys are.
I'll tell you what, I actually had a small taste of what it feels like to stand on that stage during that MLK concert. I don't remember the year. It might have been 2008. I forget exactly, but I was one of the MLK Community Service Awards recipients. And I always tell everybody that was one of the greatest honors I've ever received. So, I applaud you. I thank you for recognizing Dr. King year after year after year. Yeah. Every day is MLK Day. My father always reminded me about that. But that concert means everything to me. And you are where you are. I am where I am. Dr. Bah is where she is. Jerome is where it's all because of Dr. King provided us those opportunities. So
bottom line.
And I think we have a 4-minute performance that you're going to allow us to view.
This was something that we did just last year, but it was during Juneteenth, because we didn't have the MLK concert, but the Cleveland Orchestra wanted to do something for the community, for the total community. So they did a Juneteenth a celebration, and this is the chorus singing during that concert. In fact, we did 3 spirituals. I forget which one this one is. I think it's Lord, I Want to Be a Christian. It's a sorrow song. It's a very slow kind of song that they were able to capture. A lot of those people, like I said, don't read music. A lot of them don't read music, but they have that spirit, they have the desire, and they want to do a good job. And for them to extract that from that concert and put it on YouTube I'm thinking, wow, I guess you want the world to hear it because the world can hear it now.
So let's let our viewers hear it. Is Russell there? He can tee it up for us. Russell Johnson. Thank you.
Oh, this would be certainly Lord. Yes. Good.
Gee whiz.
Yeah, that was beautiful.
Thank you.
So a question that I've always had, and when you go off and then come back, for the audiences for your encore, and this is a silly question, and do you already know how many times you're going to come back, or is that the spur of the moment? How many times you're going to come back?
I don't know. I don't know because audiences, you have to go by how they are, and they don't lie. They don't lie. You can tell when there is a popular person on stage and someone has a cousin or a relative up there. You may hear them loud in the hall yelling. But for people that really don't know you and they respect what you do, and they just like the guys sitting on stage, that they've never heard that music before, but they are captivated by it. In fact, afterwards they'll tell me how much they enjoyed it and so forth. So I have no idea how long that applause is going to go. I have no idea.
So, Dr. Bah, we're physicians. We're going to have to start taking bows and encores. I think. So we can see what that feels like. Jerome, what do you think?
Hey, you guys deserve so much more. I mean, all jokes aside, the medical, our teachers, people like that are underappreciated. You guys have found like some way to channel all of that inside and help others, and don't get a lot of accolades for it. So I think y'all should get a couple trophies and some flowers, of course.
and like I said, I was only joking because the satisfaction is taken care of.
Dr. Martin Luther King Day with Dr. William Caldwell featuring Dr. Charles Modlin and Dr. Bah coming to you see what I'm saying?
Yeah. A lot of people don't remember or they have a tendency to forget that Dr. King's wife could have very easily performed with that choir, the Martin Luther King Celebration Choir. She was a classically trained opera singer. She was a soprano. Coretta Scott King was a soprano, and very talented. In fact, that Ebenezer Baptist Church, and I'm proud of the fact that Dr. King's wife and Andrew Young's wife all came from my neck of the woods. I'm originally from a place called Demopolis, Alabama. That's down around Selma, Tuscaloosa, Montgomery. I'm sure you've heard of those, but that's where they all came from. So when we get to the promised land, like Cleveland, and able to share what we do and find an appreciative audience, that appreciate what we do, because, I mean, when we do this music, I'm not just doing it because it's beautiful. I'm doing it because I experienced it. Yeah. I experienced the segregation. I went to a segregated high school until I was in the 10th grade. And then the 11th and 12th grade, I had to go to an integrated high school. And I didn't want to go because where I came from was much better than where I was going.
For sure.
Yeah, much better. Even the facilities. Sometimes people think, now, how can that be? No, where I came from, the African Americans were in a better building. We had more art, all those kinds of things that you can do. And then you go to another school, and they don't have that, and then you don't have that opportunity. I went to a school where they did not want blacks and whites singing together, so I didn't get to sing until I started going to college. So that's another story. So I love Cleveland for allowing me to continue my art and everything.
And we want to see you continue this for another 50 years up here, this MLK concert.
Yes.
So you're a baritone, and I trained on trumpet when I was younger, but I never had any vocal training. So can you, so there's baritone, there's tenor, so what are the different
octaves? The highest of all the voices is the soprano, and in fact the highest soprano voice is called a coloratura soprano. These are Italian terms, of course. Okay. And the lowest voice is the basso profundo. Now, when it comes to male voices, you get tenor. You have tenor, baritone, bass, a dramatic baritone, or a dramatic bass. These are terms associated with the male voice. Now, even though you may hear women say they sing baritone and tenor and so forth, they have the range to do it, but you wouldn't call them a tenor or bass. You'd just say they are contralto. Okay. Or something like that. So I'm a baritone. I don't sing as high as a tenor, and I don't sing as low as a bass. My voice is not as deep as Paul Robeson, and it's not as high as Eddie Kendricks with the Temptations, if that can help you.
So I'll tell you. I'll tell you what. I mean, contralto. One of my favorite female singers, Karen Carpenter.
Oh, yes.
I think she was a contralto, from what I understand.
Yes. And very melodious voice, very easy listening.
Oh, very much so.
Yeah. I particularly enjoy her singing during the holidays, late Karen Carpenter. Yeah.
Yes, exactly. So what is, again, you don't, I don't want to put you on the spot, but what
you got for us, man?
Yeah. What does a baritone sound like? Yeah. What's a baritone sound like? A baritone voice.
We wish you a Merry Christmas. We wish you a Merry Christmas. We wish you a Merry Christmas and a Happy New Year. That's a baritone.
There we go.
I think, Jerome, before Dr. Caldwell came on, you were saying that you're a baritone also. Let me hear what.
I was saying that Dr. Bah had the smile of a soprano, so I wanted to hear what Dr. Bah had for the holidays. She's like, she could sing as well.
No,
Well, you know what, Jerome, I understand.
We wish you a Merry Christmas. We wish you a Merry Christmas.
I told you. I told you. See?
So, Jerome, we have a couple other guests here from Kincaid Kindred Spirits support group, Sickle Cell support group.
A couple of great people, actually.
Yeah, can we bring them on? They wanted to be part of the program tonight, and they have some important information to share.
Yeah, first of all, we have Miss Glinda Dames-Finch, who has lived with sickle cell for 63 years. Glinda has a Bachelor of Science degree in medical technology, also known as clinical lab science. She was employed in clinical laboratory medicine for 26 years at two major medical facilities, 10 years as a medical/legal analyst. Her clinical laboratory experience is predominantly in acute care chemistry and hematology. She presently is disabled but retired. For almost 40 years, Glinda has participated in sickle cell support groups and helped organize and run groups for adults, families affected with sickle cell, and she is an advocate for sickle cell disease treatment, funding, and research at the federal, state, and local government levels. Presently, Glinda is a volunteer medical advisor for Kincaid Kindred Spirits Incorporated, a nonprofit adult. Let me see, what is this here? And let me see where we at. A nonprofit sickle cell support and youth mentoring group in Cleveland, Ohio. She is also a member of Northern Ohio American Red Cross Blood Services Committee and the Sickle Cell Subcommittee, which was formed to increase diversity in blood donations and in support of National Sickle Cell Awareness Month in September. She is also on the Healthcare and Criminal Justice team of the Greater Cleveland congregations representing Shiloh Baptist Church. I introduce Mrs. Glinda Dames-Finch, everyone.
Yeah, thanks for joining us. And Jerome, I would say, I don't know how she can call herself retired.
That's not retired.
That's not retired. I mean, I would be exhausted. I would be exhausted.
Retired from making an income.
Yes. Well, you've helped educate and save a lot of lives out there, and we thank you for your dedication and continued work. To educate people about sickle cell traits, sickle cell disease, to let people know that there are resources out there. There's hope out there. I know you want to share with us something about there, and this is the first I'm hearing about this sickle cell music therapy. Is that something?
Yes.
Yes.
Well, as you and Dr. Bah spoke about, with sickle cell disease, it is actually a severe anemia. It is not an iron deficiency anemia, but it's an anemia where our blood cells only last, because they are misshapen and they stick together and get destroyed quickly. Our blood cells only last our red cells only about 10 to 20 days, whereas normal red blood cells last about 120 days. Wow. So you see, we have a severe anemia. So when we have those sickle crises, the red cells stick to the blood vessels and to each other. This can happen in any part of the body at any time. And as a matter of fact, the winter time, and especially around the Great Lakes right now, is one of the worst times for sickle cell patients, because cold, getting any kind of infections, viruses, stress, all kind of things like that can cause a sickle cell pain crisis. And the major manifestation of sickle cell, starting as early as 6 months of age, is the pain crisis. This pain is beyond anything you can imagine. When I speak to medical school classes, I'm presented to medical school classes, and the professor wants me to explain it to them. I ask, if you've ever had your hand slammed into a door, or into your fingers into a door or a drawer, imagine that pain starting anywhere in your body all of a sudden. But that door is not released. It is pushed and pushed till your bones are crushing. And that you go through that pain for hours, days, and even weeks. this pain can come on all of a sudden. You know, I go to bed tonight fine and wake up in the middle of the night in excruciating pain like this. So since this disease causes so much pain, plus organ failure, all your organs can be affected. Strokes, 25% of people with sickle cell have strokes starting in childhood. We have about 25% of us have kidney failure. Our lungs are destroyed. Spleen, by the time we're teenagers, our spleens are totally non-functioning. So if they haven't been removed already. So our joints, we get a major collapse of our shoulder and hip joints. And we know people, as another person that's going to be on here in a few minutes, whose children that I know, whose son is the vice president of our group, and one of his children who passed, and we were very close. She said one time, sickle cell can cause unbearable pain that laughs at morphine. Jesus. That is how bad it is. If I have a sickle cell crisis that I cannot control at home with medication, I have to go to the hospital. They start me on Dilaudid, which is synthetic morphine, which is 10 times stronger than regular morphine. I'm not a drug addict, never have been. Less than 5% of sickle cell patients end up having any drug problems, but we are discriminated against. We are abused even. Some die, being refused care all over this country every day. Because at times we require strong narcotics, and because the majority of us are of color. So the pain situation can get you to the point where even as a teenager, you're considering suicide. So I've talked people out of it. We've talked people out of it in our support group meetings from killing themselves. And we have people come to our adult support group meetings. They bring a kid or teenager there, and they're shocked that there's some of us with degrees, that we have homes, we have children, families. They're like, you mean I can get to that? And as far as the cures that are out there, University Hospitals has been doing bone marrow transplantation of sickle cell patients, curing sickle cell patients for about 15 years. The thing is most of us, and it's been done all over the world for a good 15 years for cures, but the majority of us do not have a good match donor. And so there's actually few of us that actually get the cure. The gene therapy is still in research and in clinical trials. So that's another thing we have besides the medications that the doctor mentioned. The biggest thing is the blood transfusions are still used. I've had over 600 units. I get 2 units of red blood cells every 4 weeks for over 20 years. Otherwise, I would have had my foot cut off from leg wounds. We get severe wounds worse than diabetics. I'd be blind. And by now, I'd be in heart failure. I've also survived multiple organ failures. When you speak about music, I used to sing. I had voice lessons at Cleveland Music School Settlement. I sang in my church, Shiloh Baptist Church, starting even in childhood. But when I got multiple organ failure about a decade ago, only about 5% of us with sickle cell survived that. But those that survive, their kidney function doesn't come back. Well, God said different with me, and the doctors at university hospitals are shocked because we have an adult program and a pediatric program for sickle cell at UH, and UH has one of the oldest and best pediatric programs for sickle cell in the country. And so they were shocked that I survived and my kidney function came back, but I had gangrene of my hands and feet. They were black as coal. I still have my hands and feet. God said different, but it took the septum out of the inside of my nose and partially down my throat. So my voice is now. Not
Hey, I
singing.
was just going to ask you to hit a soprano note. What are you talking
No,
about?
it might go away, especially since my son. No. But we have, since pain is such a horrible part of this disease, we have a music therapist at university hospitals. His name is Samuel Rogers Melnick. He actually, that's been almost a decade ago, he started a research study about using music therapy to help with sickle cell pain crisis. Because at this point, I don't usually have pain crisis. The transfusions keep me stable there. That doesn't work for everybody, but I have chronic pain from the neuropathy from the gangrene. And so we have different types of pain. And since I'm 63, which is actually very old for sickle cell, the average age now is mid 30s to mid 40s. And but there's some of us that, get older, but we're rare. And you end up just having more and more chronic pain. So Samuel Rogers Melnick did a research study about how would music therapy help us. He has become a nationally sought after speaker. He is internationally in international and national journals. And there's a clip that I'd like you to show from him talking about doing the therapy.
Okay.
Might demonstrate a little bit for us what it's like to be in a session with you. What are the kinds of tools that you might bring to a session with an adult?
Sure. And building off of what Jasmine was saying, a few years ago, I was curious about when you're developing a study, it's important to consider what kind of music am I going to use, right? And so you look to the literature. Well, what is the music you're supposed to use for pain management and relaxation? Oh, it should be slow, orchestral, light piano. You start looking at these studies, and hopefully they have like a table 1 of like patient demographics, and it's mostly people that look like me or college students, and they don't report the racial demographics, right? So the patients that we work with are not represented in the pain management literature, right? Which is why I did a survey study to inform future research that asked 100 adults with sickle cell disease, what kind of music do you listen to when you have pain? Like, tell me the specific song, and we'll analyze it. If it's mostly hip hop, it's gospel, it's R&B, it's 808s, it's drum machines, it's this kind of stuff. And so I've seen things where music therapists said they weren't going to learn that kind of music, and I'm like, what do you mean you're not going to learn that kind of music? Like, you have to be willing to encounter the patient's preferred music to make a difference, right? And so building off that, my very first study was, all right, let's take these genres that these patients particularly prefer, hip hop, gospel, R&B, jazz, and soul. You wanted to marry the creativity that happens in a normal music therapy session with as much standardization as you can put into a randomized control trial. So if you imagine like a 20-minute piece of music, and these are exactly 20 minutes, it starts out at like 70 beats per minute, and then it like descends to like real chill at like 50, and then it comes back up. So same length, same beat transformation, same tempo changes in all 5 tracks, but the genre is personalized. And then to take it a step further to make it more active, we would use GarageBand and using a diatonic keyboard, so no wrong notes. I get one side, the patient gets the other side. Just do a headphone splitter out, right? And we could have a jam session that kind of sounds like this. So this is an example of the gospel intervention, and it's going to kind of go from tempo to tempo in a rapid pace. So it would sound like this. So I might say something. I'd invite the patient to say something back. And as the session will go along, music settles down, patient becomes more creative, more engaged in the process. So no musical training needed in this kind of experience. So this is like 55 beats per minute. So that's a kind of example of an experience where we try to create, it's very engaging but very accessible at the same time. And even in patients who are in excruciating pain, it can you slowly invite them to engage more and more in the process. And we find that they can do this for 20 minutes. My first experience with these patients was actually doing group drumming sessions for an hour. And building off of your prior conversation with Kelly, that's something that music therapists are especially trained to do. We're the difference between simply listening to the music versus engaging the music. We're the people who are there to process. If you have a profound emotional experience and respond to the music, we're there to provide that, therapeutic relationship and processing that turns this music tool from something that you're just sort of listening to something that you're really engaging with to assist with your health.
Yeah, I mean,
Yes, thank you all so much for having
remarkable.
me on.
Thank you.
Thank you all so much for having me on. And you've posted, I think you posted from our sickle cell support group, Kincaid's Kindred Spirits. We've been in existence since 2004. Adrian Kincaid founded our organization.
So I'd like to have you present at our upcoming Minority Men's Health Fair, Thursday, April the 27th next year. We'll be in touch to
yes,
have you there.
Yes, our men are always there. We usually
Okay.
have a table at your events. We try to have our guys there.
Okay, I appreciate that.
Thank you so much.
No, thank
Hey,
you,
Dr. Caldwell.
Yeah.
Yes, I
It
thought
looked
she-
like something. It looked like something struck your nerve over there when we was listening to that music therapy.
it
I want to
did.
know what was going on in that mind of yours.
In fact, thank you so much, Glinda. That was incredible and very, very informative. When they showed the guy holding up the little pad, just playing any note randomly, that was achieved by playing only the black notes on the piano, any chord that, in fact, the pentatonic scale. That's something we brought from Africa in our spirit. And and that's the kind of thing that if you when you go to these churches and so forth and you see people singing in various keys and so forth, the person sits down, that's because they have a mastery of those black keys.
That's
The E flat, the D flat, the A flat, the B flat, that kind of thing. So he was able to push any key on that little pad he had, but it would still sound good because it was a part of the pentatonic scale.
Wow.
I knew you had caught something. Like, wait a minute.
Yeah, in fact, I'd never seen that done before. And I went, oh my goodness. Yeah. Now, my question, if this is okay, if I can ask this, is
Of course.
when you do the music therapy like this, does it ease the pain or does it just take your mind off of it?
What it does is it is a distraction. Before they even had all of this, I was born in 1959. At 5 years old, I was starting to have pain crisis. I automatically knew having my dogs, having my dog in the bed with me that I could pet. That was the only time they were allowed in the bed. The other thing was TV or music. And what Sam has done has actually researched it and shown how this helps us, because sickle cell patients are treated by the same people that treat cancer, hem-oncs, but we tend to be left out of all of those other services that cancer patients are offered. In a lot of places, we're left out of that, and we really need that these pain management skills. And that's what he has done and is still doing. I mean, I can't say enough about Sam and the work that he's done. We've also got people, we can maybe have some people on your show another time that have sickle cell that he shows them performing everything from spoken word to, singing and so forth. But yes, Mr. Allen, who you have on next.
Yeah, let's have him come on. Yeah, Mr. Allen.
Yeah.
All right, Mr. Allen. Is he still there?
Yes. I'm here.
Okay, we can't see you on camera here. Your camera's on the floor.
Oh, dogs. Hold on. Sorry.
Hey,
Either the
hey,
floor or
man.
the floor or the ceiling, you know.
We got to be careful what's going on around here.
Apology.
There he is.
All right. It says here, Mr. Allen,
Yes,
former
sir.
member of the Mid-Atlantic Regional Genetics Network and the Alliance of Genetics Networks, now known as the Genetic Alliance. Larry was a member of the U.S. Health and Human Services Department Advisory Committee on Blood Safety and Availability. Larry was appointed to bring sickle cell to the sickle cell community. Wait a minute, how do you have this? Larry was appointed to bring the sickle cell community to the regulatory table. He served 3 terms on this committee. Over the last 40 years, he and his wife have worked with sickle cell organizations in Ohio, Maryland, D.C., Richmond, and North Carolina, hoping to connect the sickle cell community to a better level of care. During his time in blood safety, he was approached by the president of the Committee of 10,000, the nation's oldest blood watchdog group, and has served on this committee since 1999, Mr. Larry Allen.
Yeah, welcome to the show, Mr. Allen.
Thank you.
So, from what I understand, you have also some relatives who are afflicted with sickle cell disease.
Well, I'll start out by saying the first 20 years of our marriage, my wife and I raised 2 children with sickle cell.
Okay.
For the next almost 20 years, we raised 3 children because she had a son who had it. So we ended up for almost 39 years raising 3 children with sickle cell. Unfortunately, our daughter passed away in 2017. Mom and I are both from Cleveland, but we've left Cleveland twice because we ran up against the wall in terms of finding the level of care they needed at that point in their life. Complications, as you mentioned, kidney failure earlier, both you and Glinda mentioned that. And Dr. Modlin, one of the first times I met you was with my daughter at a Red Cross meeting, and you had agreed to take on her surgery. But unfortunately, we couldn't keep her out of the hospital enough to pass through all the regulations and standards that are set for transplant patients. So as hard as it was, we had to take her off of that list because staying on that list has consequences if you are still very sick. Yeah. And at that point, we left Cleveland again. She was life flighted to Duke University. And the first year there was pretty good, except there were challenges within the administration there at Duke. And the doctor that we went there to see, to work with, had to leave. And then we found another specialist in Greensboro, North Carolina. And he started actually a new day sickle cell hospital for people in the region. But within months, he started to have conflicts with the other doctors who didn't understand why he would want to keep some of these patients as long as he did in hospital. Once you really take on the job of taking care of these patients, that you feel a certain level of responsibility that many of these doctors simply do not feel. So as a result, he literally was removed from his position with the hospital he started, and they turned it over to people who just weren't as experienced as he was. So, it's unfortunate that that's been an issue. What we all have to understand is 40, 50 years ago, sickle cell was considered mostly a pediatric disease. A lot of these patients didn't live into their 60s like Glinda. So these urban hospitals were not prepared for this large onslaught of adult patients with sickle cell and all the demands that come with that. And that, along with just plain out bias, allowed a lot of these patients to be treated poorly, continuously. you will talk to people who have gone through excellent pediatric care, and then they move on to adult care, and all of a sudden now they're liars, they're thieves, they're drug dealers. It's amazing what happens to these kids just going from the pediatric end of the hospital to the adult care that they get in the same hospital, the very same hospital. So that's what's gone on for decades in our families, touring, going through this process. And if it weren't for people like Glinda and Adrian, who literally reach out and push people to go past their comfort level. You got to understand, I'm not telling any of you anything new, but once you've been beaten down and told this is who you are, this is how I'm going to treat you, it's hard to believe you're going to get better care somewhere else. So you give up.
You touched on some important things that I'm aware of. Like you said, that this generally starts, in kids at very young ages. And one thing I do know is that when the kids age out of that pediatric age range, sometimes the pediatricians and hematologists let them stay under their care until the early 20s, mid 20s, but then they age out into adulthood. And there are very few resources out there. And that's why we do need more hematologists, like Dr. Bah. We do need specialized sickle cell treatment centers for adults also. And these centers have to not only include hematologists, but also psychologists, social workers, pain management specialists. A whole team needs to come together to manage these individuals. General surgeons, urologists, pulmonologists, cardiologists. Like Glinda was saying, I mean, it affects all the different organs. So we do recognize this, and a lot of physicians, again, and this is a sad state of affairs, but it's true. We need to also better educate physicians, healthcare providers, and make them more culturally competent and get past their unconscious biases that these individuals are drug seeking because they keep on going back to the ER and requiring narcotics. So there's a lot of work that we need to do on our end as healthcare providers, and I encourage you to continue doing your work. Kincaid's Kindred Spirits, Glinda, I mean, without you, I mean, the word wouldn't be out there. And again, you're saving lives. So it's unfortunate that you've had to endure all these years of, pain and suffering, seeing your children suffer in this way. And as a result, you've suffered also. And I know that's been a big burden on you. So we will have both of you back. We're going to have Dr. Bah back because this is a subject, this is a deep subject matter, and we've covered a lot, this evening. But we need to touch on this more. And I'd like to thank Ken Hawkins, who actually encouraged us to cover this topic. But we want to, we're up against the clock right now. We want to thank Dr. Caldwell also for entertaining us, and we look forward to seeing you at the MLK concert on it's the Sunday before MLK Day.
That's correct.
It's always that Sunday. I think it starts at 7 o'clock. Yeah. So we look forward to seeing you during that performance, and we wanted to thank the audience for tuning in. To this program, and stay tuned for more.
Dr. Bah's back.
Yeah, Dr. Bah's back. So, thank you, Dr. Bah, for your contributing to this show, and we're going to have you all back on. And again, thank you, Dr. Caldwell, Larry Allen, Glinda Dames-Finch, Jerome, as always, a great co-host. So,
guys.
Everybody stay strong and enjoy your holidays and MLK Day.
Thank you.
Happy holidays.
Thank you.
God bless you all.
Thank you.
Thanks, everybody. Bye.